A new study now saying that there is no evidence that bad cholesterol causes heart disease. Here now to weigh in is family physician Dr. Jennifer Caudle. Thank you so much for joining us.
Thanks for having me.
Always love having you.
It's great to be here.
Let's first take a look at what this study found, okay? Yeah. And then we'll talk about the discrepancies.
Sure.
It found, as we just said, there was no evidence that proves that high levels of bad cholesterol, in fact, causes heart disease. Statins offer no protection to patients with high cholesterol. Doctors should abandon statins altogether. And it was a big study. It was based on 1.3 million patients. But this is the opposite of what we've heard previously. So why the discrepancies?
Yeah, I'm so glad that you asked that. And the first thing I want to say is not so fast.
Okay,
You know, first of all, for those of you who are listening at home, let's back up a little bit. First of all, this was a number of researchers that looked at a lot of studies and a lot of data, and these are some of the conclusions they came to. Now, let me address the elephant in the room, Heather, because a lot of times we see on the news these headlines: wine is good, wine is not good, chocolate's good, chocolate's not good, coffee, statins, cholesterol. I'll be very honest with you. A lot of the headlines that we see have to do with what data is being looked at, how good the data is, and how we interpret it.
Yeah. And who sponsors the study?
Where the studies are coming from, things like that. So I want to be very clear to the public out here that this is one perspective based on the things that these researchers looked at and how they interpreted data. Now, with that said, as a family physician, I have to be honest with you, it's not that simple.
Yeah.
Because cholesterol, you know, it's not that cholesterol is good, but it depends on who you are and your risk factors. Do you have heart disease? Do you smoke? Do you have diabetes? So whether you need a statin or not, and the effect of cholesterol, a lot of it has to do with your whole picture.
And just for people at home, I mean, what exactly is a statin and what is cholesterol for people?
So I'm glad you asked it that. So statin, many of us have heard the word statin. This is a class of drugs that generally lowers cholesterol, okay? And it works in a specific way through the liver, but it's a very well-studied and largely studied class of medications, and we have some good data. We know that statins in people who are high risk, that may be people with diabetes and another risk factor, such as cardiovascular disease and peripheral vascular disease, et cetera, that statins make a difference.
Have to have them. 39 million individuals use statins across the U.S.
Right,
so a lot of folks.
A lot of folks. And so the question is, do we all need statins? I mean, the very likelihood is no. We probably all don't need statins. I'm not saying all of those 39 million don't need statins, but is this something that we say everybody needs a statin? No. The question is, what are our individual risk factors that may determine that we may need them versus someone else? Everyone's not the same, and it's all about benefits versus risks.
Yeah. So you should see your family physician because one size does not fit all.
Thank you. I love the way you said that. And please don't stop your statin based on this headline. Talk to your doctor about your risks. Understand why you're on it and what your cholesterol goals are and where you need to be.
All right. Thank you so much for joining us.
Thank you.
Good stuff, important stuff for your health.